Welcome to our channel Medicine A to Z. Today we are going to talk about byssinosis. What is byssinosis? Byssinosis, also known as brown lung disease or Monday fever, is a respiratory condition caused by exposure to bacterial endotoxin on cotton, flax, or hemp dust in the workplace, particularly in textile factories. Etiology. Byssinosis is primarily caused by the inhalation of dust from certain plants, particularly cotton, flax, and hemp. The dust contains various substances, including endotoxins and other microbial contaminants, as well as chemicals used in the processing of textiles. Byssinosis is indeed a type of interstitial lung disease, specifically categorized as an occupational lung disease. It was first recognized in the 17th century among textile workers exposed to certain organic dusts, particularly from cotton, flax, or hemp. When cotton dust containing bacterial endotoxin enters the airway, it initiates an inflammatory response. This response involves the activation of immune cells and the release of various inflammatory mediators, including cytokines and reactive oxygen species. These mediators cause bronchoconstriction, leading to symptoms such as wheezing and chest tightness. Prolonged or repeated exposure can result in chronic inflammation and lung tissue damage, leading to fibrosis and scarring over time. Imaging. In byssinosis, X-ray examination demonstrates the presence of hyperlucency, diaphragm flattening, and emphysema. Diffuse and ill-defined haziness, mainly in the lower lung fields, are also seen. In CT, ground glass opacities distributed largely in a basal fashion with central-lobular nodules on high-resolution CT have been reported. The clinical features of byssinosis include coughing, chest tightness, dyspnea, and wheezing, typically occurring within a few hours of exposure to cotton, flax, or hemp dust. These symptoms are often more pronounced at the beginning of the workweek, leading to the term Monday fever. In contrast to patients with occupational asthma, who tend to experience symptoms towards the end of their workweek, byssinosis symptoms manifest earlier in the week. Prolonged or continuous exposure may also result in cough with sputum production, resembling COPD or chronic bronchitis. Complications of byssinosis: lung fibrosis, oxygen dependency, disability, reduced exercise tolerance, premature death. The diagnosis of byssinosis is primarily clinical, with a key feature being the onset of symptoms on the first day of work and their resolution towards the end of the week. Pulmonary function testing, PFT, can support the suspected diagnosis by demonstrating a decline in forced expiratory volume in 1 second, FEV1, to below 80% of predicted values. Treatments for byssinosis typically include avoidance of contact with the offending dust, such as cotton, flax, or hemp, to prevent further exposure and symptom exacerbation. Inhalation therapy with beta agonists and corticosteroids to alleviate symptoms like wheezing and chest tightness. Smoking cessation, as smoking can exacerbate respiratory symptoms and worsen lung function. In some cases, a short course of oral glucocorticoids may be prescribed to reduce inflammation and alleviate symptoms during acute exacerbations. Preventive measures for byssinosis include use of respirator masks to minimize inhalation of dust particles from cotton, flax, or hemp. Implementation of dust control measures such as extractor fans and adequate ventilation systems in workplaces to reduce airborne dust levels. Application of bactericidal treatment to raw products to mitigate the presence of bacterial endotoxins that contribute to inflammation. Regular annual medical checkups for employees, including specific assessments for byssinosis symptoms such as coughing, chest tightness, and wheezing. Incorporation of spirometry testing into routine medical examinations to assess lung function and detect early signs of respiratory impairment. Utilization of intra-shift spirometry during work shifts to monitor lung function changes in real time and identify any immediate respiratory effects of dust exposure. Stay updated with the latest in medicine. Subscribe to our channel for comprehensive videos covering the latest updates in the field.